said, my name's Laura. My background is in physiotherapy, and I currently work in St. James's on one of our surgical wards, in particular with a lot of vascular patients, and with a lot of our amputees in the acute post-op phase. So this morning we're going to be discussing exercising after a blood clot. Blood clots, as we've touched on this morning, can have many different names, like a pulmonary embolus or a DVT. So this morning we're going to touch on, I suppose, a little bit more in depth on the exercise that we would recommend after you've had a blood clot. There's been, Claire referred to the risks that are ongoing after hospital and the importance of keeping moving. So we're going to just go into that in a little bit more detail. So this morning, I suppose it's been touched on that there is a continued risk, and we want to try and prevent that after somebody's been discharged from hospital. So we're just going to go into that in a little bit more detail. We're going to touch on why we want you to exercise, what sort of exercise we would recommend, when we'd recommend that you start it, and how much exercise we'd recommend you do as well. So first off, why do we want you to exercise? And I suppose very simply, we want to keep you moving to try and reduce the risk of a further clot in the future. And I suppose physios around the country wouldn't have a job if this wasn't the case, and if there wasn't science to prove that this is so important after you've gotten out of hospital to try and reduce your risk of another incident or clot. What types of exercise would we recommend? And there are exercises that people are told to avoid, and there's lots of advice out there. So I suppose I like to focus on what you should do rather than what you shouldn't do, and that can help you to get started, because it's very challenging after a hospital stay to know what to do. So a good rule of thumb is to choose an exercise that is going to exercise your whole body. Examples might be walking, jogging, swimming, cycling, and all of those are going to get your blood pumping, your heart rate up a little bit, and you're going to feel a little bit breathless. And they come under your cardiovascular exercise. Strength training is safe after you've been discharged from hospital if you've already had a program that you've been working on. If you haven't previously strength trained, I'll cover in a couple of slides, I suppose, how you can access a professional that might give you some advice to get you started. And then some lovely exercises to include will be your stretching programs or flexibility. So yoga and balance exercises are essential for our older patients to reduce the risk of falling. So we'd recommend a couple of those every day as well. So a good place to start, if you've come out of hospital and you're not feeling fantastic and you're recovering, a good place to start is a gentle walking program. And to reduce the barriers to exercise, we'd recommend that you choose a place close to home, and that's relatively flat. So lots of us will have a lovely park nearby with a few hills in it, and I suppose just being a bit selective about the route you might take, that you might take a flatter route to begin with, and just having a think about your route, making sure that there's a couple of maybe pit stops, that you can take a bench along the way, that you can take a rest if you need to. Okay, when do we want you to start? And I suppose for most people who've been in hospital, you will likely have met somebody like myself who comes along to get you up and moving and get you started. So it's really from now that we want you to get started, and we want you to keep going with that advice that you might have received when you were in hospital. So Thrombosis Ireland has this sample walking program available on their website, and it's a lovely one to follow. So again, building up nice and slowly. So starting at a 5-minute walk at a nice comfortable pace, a couple times a day, so 3 to 4 times a day. And then in your second week, you can build that up to 10 minutes. So you're kind of taking less breaks in between. And then by week 3, 20 minutes, but we're reducing the amount of times that you're doing that a day, so 3 times a day. And by week 4 and 5, we're hoping that you're nearly at your goal of managing 30 minutes or 4 to 45 minutes. And we'd aim to do that kind of 5 to 7 days a week as well. And like I said, this is available on Thrombosis Ireland's website for you to refer back to. So how much exercise do we want you to do? And particularly for patients who've experienced a pulmonary embolism, a clot in the lung, they can be a little bit nervous getting started because that sensation of being short of breath is quite overwhelming, quite uncomfortable. So we're just going to run through what we'd recommend and what is going to feel safe for you to do. So first off, the WHO, or the World Health Organization, recommends that we aim for 150 minutes of moderate intensity activity per week. So that's a general rule, and what's great there is you can break that down to fit into your timetable in between whatever you have going on day to day. So if that's 5 30-minute slots, you can break that down throughout the week or make it even a little bit shorter over 7 days if that suited you better. As I said, the World Health Organization does specify that this activity that you get should be of moderate intensity. So we would usually measure how intense an activity is for you by your level of shortness of breath, which can be a really overwhelming sensation. So, just to kind of reiterate that we do want you a little bit short of breath, but it shouldn't be too intense. So I like to refer to the Borg scale of perceived exertion. And you can see here, number 1 on the scale would be, watching TV or having a sleep. And we would never recommend that anyone pushes themselves to, a rate of 10 without maybe a doctor in the room. That would be a very intense exercise test. We like to stick to a level of 4 to 6 of moderate activity. So a nice rule is being able to speak but not being able to sing. That's a nice kind of rule that you might have. So if you're on a walk with a friend, if you find yourself able to chat away, you're going at a nice pace, but you should be a little bit short of breath that you wouldn't be able to sing a song. Then for resistance training, so after a hospital stay or after, I suppose, any instance where you've had a break in an exercise program, we would recommend that you start on lower weights and gradually increase it as you feel able. So for people who are used to a weight training program, you can listen to your body. You're going to know what feels right because you're used to lifting some weights, but we would recommend you just start maybe a little bit lower than where you left off. If you want to begin a weight training program, and this is an excellent form of exercise that's going to keep our bones healthy as well as our muscles, we would recommend that you seek some professional advice, and you can ask your general practitioner, your GP, to refer you to your community physiotherapist, or you can seek the advice of a chartered physiotherapist. And there's a list of those on the ISCP website as well. So how do we want you to exercise? So we've gone over just some general ideas, but just to incorporate these tips into your day-to-day and to help you measure how much exercise you're getting, simple things like walking to work, and I'm sure we've heard it 100 times, but you can park a little bit further away from the shops or get off the bus a stop early, or if you're lucky enough to live close to work, you could walk to work as well. Take the stairs instead of taking the lift is a really simple way to, get your heart rate up a little bit and keep the legs moving. Most of us have smartphones these days and have a step count on our smartphones. Or if you have a watch that's going to track that, that can be really helpful. I know personally I have an aunt who's quite competitive with my other aunt, and if they compete to reach their 10,000 steps each day. So that can be a nice way to do it, is if you get a family member or a friend in on it, just to help keep you motivated as well. After lockdown, we're very privileged to be able to access lots of exercise programs on the internet. So if you're a little bit shy about starting somewhere outdoors or in a class or in the gym, you can familiarize yourself with some exercises in the home that you can follow online. Then if you're feeling up to it, you can join a class. Most of our gyms across the country will have, a class that is suitable for older people, and there are personal trainers in the gym that you could link with, just to let them know that you have a background of a clot or you've concerns, or you can speak to your physiotherapist before you go. And then in most of our parks, we have the couch to 5K, and lots of these are starting to return now, your park walks and park runs. So they're a really nice way to get outdoors and get some fresh air as well. But it is important, I suppose, while we're saying we do want you a little bit short of breath, your body will know if something doesn't feel right. So we do want you to listen to your body. If you're concerned that, your shortness of breath isn't settling after you've taken a rest, you can reach out to your GP, and it's important to check that out just to make sure that we're exercising safely. Okay. So I suppose in terms of reducing the risk of further clots, I've gone over lots of things that we do want you to do. So we want you to move and get started on an exercise program, and build it up slowly. What we don't want you to do is spend long periods sitting. And for lots of us, with working from home, office jobs, there are lengthy periods of the day that we spend resting. And as we get back to traveling more, people will be on planes or trains, and there are lengthy periods of resting as well. So a couple of tips that I'll run through now just to try and reduce that risk when you find yourself in a situation that you have to be sitting for a period. So, like I said, avoiding those long periods where possible. For any of your plane or train or car trips that we're hopefully getting back to in the next few months, if it's more than 4 hours, we would recommend that you take a little stroll around the plane, or get up to walk to the toilet. And if you're watching TV at home, you can kind of get up during your ad breaks to grab a cup of tea, although I know we're watching most things online these days, so there's less and less ad breaks. But taking a little pause in between your watching to have a little walk around the house. And at work, maybe walking to the printer or the water machine that's a little bit further away as well every hour or so. If you do find yourself in, on a long haul flight or on a train that's quite busy, and I'm conscious that obviously we are encouraging people to keep their distance, and so if you'd rather not walk around, a couple of simple exercises that you can do when you're sitting is, some marching on the spot, and that's really simply just lifting the knees up towards the chest. And the reps here are down as 20. I would say that, I don't think you can do too many. If you're on a long haul flight, we do want to keep the legs pumping, but 20 is a nice guide to have. A really lovely one and really important for preventing our DVTs are our ankle pumps. So simply pointing the toes up and down so that your ankle is moving and you're switching on that calf muscle. And again, the reps here are 20. I think you could definitely manage more if you're feeling up to it. I don't think you could do too many of those. And then some knee extensions, or I like to just refer to these as kicking out. So just lifting the foot straight out in front, straightening your knee. And this way you're switching on the muscles at the front of your legs, your quads, just to keep all the blood pumping through the lower limbs. And there we have a guide of, a reps of 20 and a set of 2. So that would be 40 in total. So the overall message, I suppose, is that we want you to keep moving gently, but to do it frequently and often. Like I said, you do have access to physios through your GP, or privately if you'd wish to seek one, you can search it on the ISCP website as well. Your physio is definitely happy to answer any questions to keep you moving, if you have them. Okay, thanks a million.
Thank you, Laura. That was really informative. Thank you. It was brilliant. I have a couple of questions. I have had a DVT, and I find when I go for a walk that my leg gets sore. Should I keep it up or stop?
So I suppose we'd want to know a couple of details about how recent the DVT was. If you are just out of hospital, you're likely to have some aches and pains that continue for a little bit of time. So walking through a little bit of discomfort is okay, but if you are concerned that the pain is severe, just checking in with the doctor, or asking your doctor to refer you to your community physio just to check it out and make sure you feel confident to keep going.
Great. Another question. How soon can I start exercising after I've had a blood clot?
So if you've been admitted to hospital, you'll be started on some blood thinners by the medical team, and you'll be referred to a physiotherapist, and usually we will come straight in to get you started up and walking as soon as possible. So we'd recommend when you leave hospital that you keep that up, so you can start very quickly after you've had a clot.
Okay, brilliant. So probably once your anticoagulation medication kicks in, then it's a good idea to get going.
Exactly, yeah.
Okay, that's brilliant. Thanks a million, Laura. That's we'll finish up there, and thank you.
Perfect. Thanks a million. Thanks for having me.
Bye.